Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today we have a year in review, lessons learned in 2024 episode. So I'm going to reflect on a year of growth. I apologize if you're watching this on YouTube because I might have some eye reading, and that's just how it is going to be. So I can reflect on all of these amazing guests that we've had on the Get Healthy Tampa Bay podcast. I want to thank each and every one of them from the bottom of my heart for giving up their time and expertise to share with us and all of the listeners their knowledge. So 2024 has been a transformative year for the Get Healthy Tampa Bay podcast. Through incredible guests and insightful discussions, we've explored a wide range of topics from obesity medicine to emotional health, alternative care, and women's health. This episode is going to be a reflection on the key lessons learned and the actionable insights I've incorporated into my practice. I learned so much doing this podcast, and I just can't even get over, how much I bring back to my practice of what I learned. And I hope that you all learn a lot too. Let's dive in. So obviously, one of my most favorite categories is obesity medicine, weight management. So obesity medicine requires compassion, personalized care, and an emphasis on sustainable change. This year, we heard from remarkable guests who shared their expertise and strategies. One was Dr. Sarah Bowden. She is an anesthesiologist. She emphasized shifting the focus from BMI, which is basal metabolic index, to metabolic markers like triglycerides and fasting insulin to, have a better gauge on someone's health. She discussed the role of GLP-1 medications such as semaglutide in addressing insulin resistance while incorporating lifestyle changes tailored to patients' needs. Then we also had Dr. Sarah Stombaugh. She's been on twice now. Her first episode was last year on breastfeeding and weight loss. And this year she came back to reinforce the significance of eliminating ultra-processed foods and highlighting practical strategies for sustainable dietary change, including adopting lower carb diets or simply focusing on whole foods. She also offered the GLP-1 guide and how to, manage, every side effect, symptom, and every which way you need to know about GLP-1. So you can check out her episode on that to find that in the show notes, the guide that is available for her. And then I had a few solo episodes this year. One was discussing the Mediterranean diet, one was unveiling nutritional labels, and then we also had the top 12 habits hindering weight loss. I explored common challenges such as snacking while distracted, consuming sugary drinks, and inconsistent meal timing, basically also really focusing on need of that 12-hour fasting window. I provided actionable steps and tips to break these habits and create lasting changes. So the key takeaway here is that effective weight management is not just about the scale, it's about metabolic health, emotional well-being, and empowering the patients to make informed, sustainable choices. Then we had some really unique perspectives on heart health this year. It was a recurring theme. We had some nuanced discussions on metabolic health, preventative care, and patient-centered approaches. One was with Dr. Philip Ovadia. He's a cardiothoracic surgeon. He shared his journey to improve metabolic health and his emphasis on prevention over intervention. He highlighted the triglyceride to HDL ratio as a superior marker of heart health and explained how a low-carb, high-protein diet supported his 100-pound weight loss and long-term cardiovascular health. His approach focuses on keeping patients off the operating table through lifestyle optimization. And in differing opinion, we had Dr. Tracy Pashetsky, sorry if I messed up your name again, who is an integrative cardiologist, and she discussed her holistic approach to heart health, emphasizing the role of stress management, personalized care, and patient education. She highlighted her preferences for a plant-based diet and incorporating natural remedies alongside traditional cardiac care to prevent and treat heart disease. So basically, the takeaway from this section is that heart health requires a multifaceted approach that combines advanced diagnostic, individualized care, and lifestyle changes to prevent disease before it requires surgical intervention. We had a lot of skin health discussions this year. This year, we explored practical and evidence-based approaches to skincare and dermatologic health. We had Dr. Mary Alice Mina share her approach to no-nonsense skincare, emphasizing the importance of sun protection, regular skin checks, and avoiding unnecessary cosmetic procedures. She highlighted the role of personalized skincare routines in preventing and managing skin conditions. And then we had Amanda Smay, PA, who debunked myths about acne management, emphasizing the importance of gentle skincare, hormonal considerations, and evidence-based treatments like topical retinoids and benzoyl peroxide. She also highlighted the psychological toll of acne and the importance of treating it early to prevent scarring. So the takeaway in the skin health area, it's about consistency and prevention, incorporating tailored routines, sun protection, and addressing underlying causes of skin conditions like acne. Then in the emotional and mental health space, it was a central theme with practical tools for managing stress, anxiety, and emotional resilience. Dr. Shahana Alibayi introduced her four-step framework: acknowledge, awareness, acceptance, and action, designed to improve emotional capacity and mental well-being. Dr. Diana Barrett explored dementia care and its impact on caregivers' mental health, offering strategies for managing associated anxiety and depression as well. She also really dived into Alzheimer's disease and how to treat and diagnose it. We also had Dr. Daniel Hochman, who shared insights into addiction medicine, highlighting the interplay between emotional pain and substance use and the importance of breaking stigma to foster recovery. Please look at his episode to see more about his program that he offers as well. Then we had Dr. Robin Tiger, who provided actionable strategies for stress reduction, such as celebrating small wins to boost dopamine, setting realistic expectations, and using mindfulness techniques. Key takeaways from this section is addressing emotional health is vital for overall well-being. Practical frameworks and tools empower patients to navigate stress and improve mental resilience. We had a lot on women's health and menopause. This year, we delved into the unique health needs of women across different life stages. We had Dr. Nabila Noor discuss the similarities between postpartum hypoestrogenism, which is called genitourinary syndrome of lactation, and its association with menopause, advocating for hormonal support and pelvic health education. We had Dr. Danielle Krulasat emphasize the importance of long-term follow-up care for women with preeclampsia or gestational hypertension who face increased risk of cardiovascular disease. She advocated for regular metabolic monitoring postpartum, and she really taught me that we can't lose these patients to follow-up because they're at high risk for developing problems later on in life, and early intervention can prevent these things. Dr. Sadaf Lodi provided valuable insights into sexual health during menopause, addressing topics like vaginal dryness, libido, and relationship dynamics. She emphasized the importance of creating safe spaces for women to discuss these often overlooked issues. Dr. Maureen Maciel highlighted the importance of early bone health, explaining that peak bone mass occurs by age 20 and declines around age 50. She emphasized strength training and vitamin D as critical tools for preventing osteoporosis. Dr. Mary Lum provided valuable guidance on managing emotional transitions during menopause using gratitude and resilience building strategies. And in my own learning, not necessarily a podcast episode, I learned that we didn't learn anything about menopause in medical school. So I took it upon myself to take a course in menopause focused training, covering management of hot flashes, insomnia, mood changes with hormones therapy, and lifestyle adjustments. Women's health requires a holistic, lifelong approach, addressing postpartum care, bone health, and menopause with compassion and evidence-based care. Then in another area, we had alternative medicine, which I found very interesting and learned lots in this section. There were some innovative therapies and integrative approaches provided new perspectives on health and wellness. So Dr. Victoria Minold shared the benefits of acupressure for managing stress, nausea, and pain, empowering patients to incorporate self-care into their routines. We had Dr. Ray Moore explain the use of dry needling for chronic pain, sports injuries, and tension relief, demonstrating its efficacy for musculoskeletal issues. We had Dr. Raul Bandari explored radiation therapy as a non-invasive treatment for osteoarthritis, offering a promising option for chronic joint pain. We had Dr. Manju Dawkins introduced Thimble Health, a solution designed to alleviate needle anxiety and improve access to healthcare. We also had Dr. Vivian Asamoah discussing managing GI gastrointestinal conditions like SIBO or small intestinal bacterial overgrowth through functional medicine, highlighting the importance of personalized dietary strategies. So alternative and integrative medicine complements traditional care, offering tailored solutions for pain relief, stress management, and overall well-being. Then we had several episodes about habits and lifestyle change impacting health. So, in small, consistent changes in habits can lead to profound health improvements. We had Sandra Calkins share her journey from fitness member to gym owner of Burn Boot Camp, emphasizing the power of community, strength training, and nutrition in achieving sustainable health goals. Dr. Kara Pepper discussed gray drinking, which and encouraged patients to evaluate their subtle drinking habits and their effects on mental and physical health. Dr. Stacy Funt offered practical tips for maintaining healthy habits while traveling, such as staying hydrated and prioritizing movement and nutrition. Health is built on these foundational of daily habits, whether it's rethinking alcohol, embracing fitness, or staying active while traveling. Individualized care in medicine. This is probably one of the biggest things that I have found from this year talking to everybody. Everybody's moving to a personalized approach of healthcare. It's the key to better outcomes and stronger patient-physician relationships, whether it's people who are starting direct primary care or direct specialty care practices so they can spend more time with their patients than the typical insurance model, or episode with Dr. Yel Ora, who highlighted the critical role of nocturnists in ensuring continuity of care for hospitalized patients and how to take care of those people who are working overnight and how can they have their best health and wellness. And Dr. Mary Lung, once again, discussed balancing professional and personal responsibilities, providing actionable strategies for building emotional resilience and gratitude. Individualized care respects each patient's unique needs, fostering trust and better health outcomes. I truly believe that with all of these things, in everything that I've learned about menopause care, it's very individualized and nuanced. Everybody's going to be different. There's no standardized dosing of anything. And same thing with weight management and heart health, as we learned. Everything needs to be individualized and taken, to each person, and they're all going to have different things and needs and ways to support them in their health outcomes. So in conclusion, it's really been a great year of growth and learning. This year's episodes have been a journey of learning and growth. I'm grateful to our guests for sharing their expertise and to you, our listeners, for engaging with these important conversations. As we enter 2025, I'm excited to explore new topics and continue building a healthier, happier community. If you guys have anybody who you think would be a good fit as a guest on the podcast, please reach out to us at podcast@cfma.health. And please, listeners, like, review, share. If you had any great episodes that you enjoyed the most, please let us know. And if you have any ideas for topics for next year, please let us know. And if you need a primary care doctor or a allergist, asthma immunologist, or an obesity medicine physician in Clearwater or Palm Harbor, Florida, please look out for us at www.cfma.health or 727-446-1097. And this is Kerry Reller signing off for 2025. Happy New Year, everybody. It's going to be a great one. Take care.